Hello and welcome to TV on TV. I'm State Representative Tommy Vitolo. You're watching Brookline Interactive Group. Today is Thursday, July 18th, and we have a great show for you today. We have the second in a three-part series. We've got Greg Schwartz, candidate for the South Brookline, South Newton state rep race in the Democratic primary. That seat is open because current rep Ruth Balzer is retiring at the end of this session. There are three candidates. We'll have all three. We had Bill Humphrey last week. We'll have Rick Lipoff next week. This week, we've got Greg Schwartz. I hope you'll stay tuned for this interview recorded about a week ago. But first, as always, we're going to do the news. Former United States President and presidential candidate Donald Trump was shot in his right ear on Saturday during a campaign rally. Attendee Corey Comparatori was killed by a bullet intended for Trump, and would-be assassin Thomas Matthew Crooks was shot and killed by Secret Service agents. The Republican National Convention began Monday. Delegates elected former President Donald Trump and Ohio Senator J.D. Vance as their candidates for president and vice president. Last Thursday, a car drove into a geyser at Yellowstone National Park. Thankfully, all occupants are safe. Last week, the Massachusetts House passed H. 4844, an act providing protections for reproductive or gender-affirming care locational information. The bill protects individuals' data regarding access and researching reproductive and gender-affirming health care, including all care related to pregnancy, contraception, miscarriage management, and abortion. Archaeologists have discovered 5 musket balls from the Battle of Lexington and Concord, propelling our understanding of the shot heard round the world. The projectiles are suggested to have come from militiamen. For the second time this year, a flamingo was spotted on Cape Cod. Zoologists explain that the birds were confused after being taken along for the ride with Hurricane Idalia last August. Brookline's Baker School is facing criticism for the extent in which educators taught outside their areas of licensure. The survey found high approval ratings of town government among Brookline residents. An overwhelming majority responded as satisfied with the town's ability to provide services. The gripe? The rent is too damn high. Hebrew Senior Life has announced a lottery for 54 new affordable units for people 62 years and older. Applicants must meet income criteria to qualify. Folks, that's all the news we've got today. We're going to ask you to stay tuned. We'll go to the flip side, and I've got an interview with State Representative candidate Greg Schwartz, running for the state rep seat for South Brookline and South Newton. Stay tuned.
0, all engine running. Liftoff, we have a liftoff.
And welcome back. As promised, our guest today is physician, attorney, former Newton City Councilor Greg Schwartz, running to be the next state rep in South Brookline and South Newton. Thanks for being on the show.
Thanks so much, Tommy. It's great to be here.
I know you've got a lot going on. I've been there, right? Campaigning takes a lot of time. And so I'm grateful you're able to spend some time with us on TV here on Brookline Interactive Group. I'm going to start in the same place I start with all of the guests. And that is, to help folks get to know you a little better. What have you been doing your whole life? What's going on?
Well, I started out growing up in New York City, and I was born to a family of two parents who were pretty involved in local politics on the Upper West Side. They were young Democrats, Reform Democrats, trying to move the party away from the bosses. And so I grew up with that awareness and that model. They fought against some projects that would take away our park, a big highway, a Robert Moses-esque highway that would have gone down the west side of Manhattan super lanes of highway that would have taken away our park. They were fighting against that. So I saw that growing up. I also saw growing up my mom get diagnosed with a pretty devastating neurologic illness called Parkinson's disease early on. I was 9 years old, and so I was seeing the kind of the effects of illness. And when I went with her to her appointments as I got older, I saw a lot of good and bad doctoring, and that actually led to my commitment to becoming a doctor. So I saw the benefit of a doctor who cared, who was compassionate. I wanted to be like that for my patients, to be there for people like my mom. I went off to college and was pre-med, was planning to do medicine, but I got excited by politics, and I joined the Dukakis campaign for president in 1988 and was a student for Dukakis, and went down south to Atlanta for the convention, and we were riding high at the end of that convention. Unfortunately, didn't last, but the Duke was amazing. Ended up majoring in government, went and worked in a couple of situations after college in DC, working for a health advocacy group against tobacco companies, and then as a legislative aide to a congressman. So it was in that context that I saw the value of people who were trained in the law and in advocacy, and how effective they could be in the policymaking process. So when I went off to med school, I had an opportunity to also do a law degree, and I did that. It was at Yale, which is a very public law-oriented place. So I was among many people who were interested in making a difference and using the law for good, and to see how you could use it to make good legislation. So it was a very exciting place. It's where I met my wife, who's now a judge. And I went off to medical residency here in Boston and became a primary care physician. And I've been doing that for the last 20 years at the Mass General in Brigham. And while I've been taking care of patients every day and in and out of the hospital, I've tried to stay active in politics and policy. And so I was involved with a campaign to amend the state constitution to make health care insurance a right. I worked to reduce prescription drug prices. I've continued to be active in my professional societies advocating for legislation that will improve patient care. And then about 2011, with my kids starting in the schools in Newton, decided to get involved locally in politics, and I got elected to the city council. I served for 8 years as city councilor in Newton, and saw up close all the issues that cities and towns are working on and are facing, whether it's education, transportation, housing, environment. We were very active and passed a climate action plan for Newton that was very effective and very forward thinking. So I did that through 2019. Then COVID hit. I've been in the hospital a lot during the last 4 years, and I've seen the decline and this kind of disarray that's developed in our healthcare system, partly because of COVID, partly because of the changes in the provision of care, with for-profit coming into Massachusetts, and also the nonprofits becoming more corporate in their activities. And so that's one of the reasons why I'm running. With Ruth Balzer retiring after 25 years, she's a champion of mental health services and access and public lands preservation. I want to continue that legacy, but I also want to bring my healthcare experience to address the problems in healthcare that are facing us: primary care access, access to specialists, the difficulty in the emergency rooms being overloaded, and of course the steward type of health problem, health insurance problem, that we've got for-profit systems that are going bankrupt, and that's affecting many people's access to care. So I'm super excited. The campaign's been just an opportunity to talk about these issues with so many voters. The state level issues are very relevant to the cities and towns. When I was a city councilor, I knew how important it was to have a good partner at the state level, and Ruth and Kay Khan, great partners, along with Cindy Cream. And I'm just so excited about trying to fill Ruth's very big shoes. Very proud that she's endorsed me, showing her her belief in me as being the best candidate to follow her and continue her legacy.
Big shoes, but not especially big feet. Um, so you sort of talked about, like, you made the case for why you're running for state representative, and even in fact why now, sort of post COVID and watching the healthcare system. It sounds like you're saying change for the worse in at least several ways. Um, you've kind of been in and out of politics. It sounds like your whole life, and for the last few years you've been out, and now you're thinking about coming back in. Has running for state rep or sort of state level politics been something you've been thinking about for years and decades, or is it sort of this is the thing that's presenting itself right now, and geez, it's what an opportunity? How is it you came to decide to run for state rep in 2024?
Well, it's a great question. Probably a little bit of both. I've been certainly focused on the state level for a long time. I can tell you that in law school, one of the things you do is you often look at a law and you look at what the different states have done on that issue. And there's usually a majority kind of law, and there's a minority law in that, the majority of states do it this way and minority of states do it that way. And so the state level is just so important, and it's where you really can make changes and affect the policy goals that you have. I saw that in law school, and so the state has always been a focus of mine. But you're right. Why now? A big part of it is that there's a crisis that I see, but also, when Ruth decided to retire, it opened up an opportunity that had not been open for many years.
So I want to stay with this a little bit. I am not a healthcare guru. I do my best to go see my GP once a year, because otherwise I guess my wife's insurance gets more expensive or something. I do what they tell me. But you have all of this experience, and clearly so much of our healthcare is determined by federal policy that frankly Massachusetts doesn't have very much direct influence over. Some have made the case that Obamacare is a rewrite of Romneycare, which was actually drafted by now Speaker Ron Mariano. What are some of the places where the state can set some policy and really make a difference in the healthcare field? And that could be insurance, that could be the hospital. There's a lot of different places where this shows up. It's not just health insurance. What are some places you imagine the state tightening some screws or doing a better job to really make people have healthier lives in Massachusetts?
Yeah, absolutely. I agree with you that the federal government does a lot with the Medicare policy and with insurance policy because of ERISA. But what I tell people is there are at least 3 or 4 places where I think the state can play a huge role. One of them, as I was alluding to with changes from COVID, is in workforce. So one of the reasons why we are seeing the terrible backups in the emergency rooms and the difficulties in getting access there is because so many people left the field of nursing and assistant nursing and medical assistants and healthcare aides, and we need to do workforce policies to expand and replenish those careers. And there's so much that the state does in workforce planning that can certainly be a focus. There are many programs that we can institute that would help folks who are interested in a entry-level career come either directly from high school or from community college into programs that would train them to be nurses' aides and healthcare aides. And that would enable the facilities that have been so understaffed to be able to take the patients that are ready for discharge from the hospital or who can go home if they have home care. And that would unload that pressure in the system that is currently backing everything up into the emergency rooms. And that's what people are experiencing. A second way to impact on our health industry and our healthcare is through truly emphasizing and funding and valuing primary care. I know I'm a primary care physician, so perhaps I'm a little biased, but all the data agrees with me that when a system has more primary care physicians and more primary care access, the costs are lower and folks get better outcomes. And so I'm really excited about the healthcare committee's bill that Cindy Friedman, I believe, in the Senate has been promoting to double the investment in primary care for the state, to expand. That'll enable us to expand services and also to encourage more people to go into primary care, both doctors, and I think that they're making some additions to the bill to encourage other providers. And that is just so important, both from a retention point of view, an access point of view for patients, and also when you put more, and I wrote a letter to the editor about this in February in the Boston Globe, which I was proud to have published. When you put enough reimbursement and value on primary care, it tells the institutions that house primary care and that run it, that to put more into the administrative support for it, so that you don't get the burnout and you don't get the folks answering patient messages at 2 a.m. on their computers at night, which is not good for either side of that equation. So that's the second thing. And then the third thing is purely, we do control the Medicaid program, Mass Health. So reimbursement in Mass Health can be increased. Mass Health can be improved. The eligibility is something that the state can adjust. And that's a very, very important part of getting the kind of care that we need to patients, especially in some of the hospitals that serve, communities that have traditionally been underserved. And that might be one of the ways that we actually get ourselves out of the steward mess. And that's the final thing that I do talk about with folks. Steward is just an example of what happens if we let for-profit hedge funds get into healthcare, putting profits before people. And the state, while it was trying to manage the steward, system, did not have enough power to force the reporting that would have given a heads up earlier that these hospitals were in trouble.
And so, you come with this experience as a physician, as a primary care physician. That's how you make your living today. If you're elected in September and, get sworn in January, how do you continue your work as a physician? Are you going to, try to work both jobs? How are you going to proceed in terms of employment should you be elected?
Well, should I be elected, which would be, a great outcome for me, I would put my focus on the state legislature job. Certainly, it's a big job. I would put all my efforts into it. What I have been talking to people who are at the State House and other legislators do tell me that many times they maintain a little bit of their professional work so that they can maintain a touch of reality in their work. And what I understand from the legislative calendar, there are times when there's a little bit more open time than at others. So I certainly in the first term would be really focused on the state legislature and job and be looking to see where and if there's any opportunity to maintain a foothold in the medicine. But I'm super excited to do this job. I want to do this job, and I will put my all into it.
You served, switching gears a little bit, you served on the city council for 8 years. No doubt a fascinating experience. And if you haven't worked in municipal government, it's really where the nuts and bolts are happening, right? Tell me about sort of, what you came away with and frankly, what experiences you will carry with you that come from your time on the city council.
Well, thanks. Yeah, the city council experience, which all three of us running have, is, I think, indispensable to being active in policy, because that is where the rubber hits the road. The thing I take away from my experience, which I learned while I was there, on the city council is the fact that so much of the issues are not black and white. They're complicated. There are easy issues here and there, but so often there are two sides to an issue that have some validity, and you have to be able to listen to both sides and really be able to pull out the salient aspects of each side's arguments, whether it's leaf blowers, which on the one hand are a terrible scourge from an environmental and public health point of view with their gas motors and the emissions, versus the fact that they're a significant source of business for landscapers, and the landscapers have significant costs, and you have to take into account their business model. We tried to bridge that gap. There was a lot of consternation in Newton about that. I think we came up with a workable plan ultimately, but it definitely showed me that you can't go into something without considering the other side. The other issues, we're always trying to put in more bike lanes. You need to find space in our very limited already built environment, and sometimes it requires taking away parking spaces, which is fine in some places, but in other places it affects businesses. So working through those complexities, and those are just a couple of very minor examples, is very important. There are bigger examples. The housing development projects, certainly you need to build. We have a lot of housing that we need to get going. There are implications, though, whenever you build on the communities that they're in, the externalities that they create, and the level of rents that the apartments that they'll ultimately create will cost. So those were some of the bigger issues that also required listening to both sides, not taking a doctrinaire approach, coming out with a good outcome that achieved our policy goals, but also took into account the gray of the issue.
You bring up housing. As you know, housing is a major political conversation in Massachusetts, and likely, in my view at least, will be for years, perhaps a decade or more to come. You have experience. I believe you were the chair. I don't know if I have the vocabulary right. The chair of the land use committee or the zoning committee on the Newton City Council. I'm a town meeting guy. I don't know all these details. And I know that there are likely maybe some nuanced differences between the candidates. Help us get a feel for how you anticipate balancing sort of state policy with local policy, and that communities are different, but we're all in it together. When it comes to housing, what should we expect?
Yeah, so it's a huge issue. It's one of the major ones that comes up as we go door to door. And I think that there's a growing appreciation that it's a complex issue that doesn't have simple, as I said before, black and white answers. As I was alluding to earlier, you do need we're way below the number of units that we need statewide, Boston area wide. We need to be building. And a lot of the focus at the city and town level is on development projects that come in from developers that are heavy on the number of units, and a small portion of those are deemed affordable, and the other 80 or 75% are end up being very high-end market rate. And so while we need to be building, we also need to be filling that middle, which we're not getting at the city and town level with those development projects. And that's where the state policy can be extremely helpful, I think. Our free market alone is always going to maximize profits, and that's understandable. It's a capitalist country. But with the state involvement, either through tax benefits or loans, low-cost loans, or state lands being available at low cost to some of these potential projects, we can really be creative and come up with ways to deliver housing that's middle cost and in the middle for the folks that we often talk about who are being priced out of our towns and cities, people who are teachers, people who are new young professionals, people who are firefighters and police, all of those folks and seniors downsizing, all of those folks are not being well served by the current model, which is understandably reliant on the private sector following its profit motivated procedure. So, as City Council, chair of the Land Use Committee, I was responsible for reviewing some of these projects. I always wanted to make sure that the folks on both sides got a chance to be heard and fully considered, and I'm proud of that record. I think that sometimes other folks in the conversation came to it a little bit more doctrinaire, and that was not, I thought, as helpful.
Certainly loads of work to come. Half a question, not even a whole question. How has your family engaged in this race? How have you maybe, how does your family influence the way you think about this race? How is it on the campaign trail? In a couple of minutes anyway, how's it feeling?
Well, it's been a great experience for both me and my family. I think it's a lot of fun at this stage of our lives. I've got to admit, when I ran for city council initially, one daughter was turning 3 and one daughter was just about 6, and they both initially thought, oh, going around knocking on doors, it's like trick-or-treating, and they pretty quickly saw that wasn't the case. They got tired of me talking to people and they wanted to go home, and there was no candy. So so these days, though, and then throughout the city council time, working away from home on the evenings, missing bedtimes, I think that they didn't view it in the most favorable light. Although I always did try to, make sure that they understood, and I think they did, how important it was what we were working on to impact the city and town that you live in. But now I've got a 16-year-old and a 19-year-old, and one of them, a freshman in college, she comes home from that and she gets right involved in the campaign, and she's not shy about telling me where I'm wrong, and she's got the youthful energy and open-mindedness that is very refreshing. And my 16-year-old and her friends are super excited about volunteering, and we've got a lot of young energy on the campaign this summer. And my wife puts up with it all.
We are just about out of time. I know folks may want to learn more about you. Where on the internet should they go to find that information?
Oh, well, thanks, Tommy. So my website, our campaign website, is teamschwartz.org, and you can check it out. And we also are on Facebook, and you can always sign up for any of our mailings and newsletters through the website. Again, that's Team Schwartz, SCHWARTZ.org.
Folks, we've got a race. The election is September 3rd. That's a Tuesday. Polls close at 8 p.m. Of course, you can vote on election day. You can vote early by mail. You can vote early in person at the town clerk or city clerk's office. You can vote early by dropping your ballots off in drop boxes. Lots of ways to vote. Everybody gets up to one vote. The question is, are you going to use yours? The winner of the September primary will be the next state rep from the 12th Middlesex. There are no Republicans or independents in the race. So this is your shot to decide if you live in South Brookline, precincts 5 but not 5A, 14, 15, and I think 13A. I don't know the Newton. What are the Newton wards?
So wards 5, 6, 7, precinct 1, and 8. And
so, look, there's a governor's counselor race on the ballot in the primary. There are some Norfolk County races if you're from Brookline on the ballot, and there's the state rep race. You got to get your voice heard. You got to get your vote counted. Make sure you vote on September 3rd. Folks, thanks for watching TV on TV right here on Brookline Interactive Group. Greg, thanks so much for being on the show.
Thanks, Tommy. I appreciate it.
And best of luck on the campaign trail, folks. We'll see you right here next week. Till then.